we need to be careful about trying to dumb down health based on the perception that that's what people want, right? I think it almost turns the field into a joke. And, I recently saw Saturday Night Live had a clip about biohackers and longevity and, again, making fun of this space, which is fine. But I think it does run the risk that we lose credibility and become untrusted and in some ways, a sideshow, right?
By doing what?
By dumbing it down too much, by being dishonest with people.
Gotcha. Because that's an interesting point, because it's like what we need to do is educate and then provide the tools for people to make the right interventions.
That's right.
That's not going to get criticized.
And maybe we will have one. I mean, maybe glycan age will be the best single marker, right, down the road. I hope that's the case. It may be. But what I would say is, I don't think we're ever going to get to one thing you can measure that will tell you everything you should do. I do think we're not so far away. And again, let's not let perfect be the enemy of good enough. Also, I don't think we're so far away. In fact, if you know how to do it today, you can get pretty close with the best AI tools that are available. You capture the data that I laid out, what we do at Optispan, you can get a pretty darn good personalized recommendation plan that will have a significant impact on your health. And so I think as these tools evolve and people come to trust them more, regulators hopefully will come to trust them, and doctors learn how to use them, that's a scaling opportunity to bring this kind of healthcare to a lot more people. And it's easy to see the path. Like, we can get there. This is something that can happen. Whether it's going to be available for the majority of people or the wealthy minority in the next 5 years, I think is unclear, but it could be available for the majority of people if society makes the right choices and invests appropriately.
Society makes the right choices and invests appropriately.
Yeah.
How?
Well, so again, I think there are cultural factors that come into play, right? That make it difficult or perceived difficult for people to adopt a healthy lifestyle. The US government thus far has not, even though there's been some talk about emphasizing proactive healthcare, there's been nothing substantial that's been put forward. I think the culture of medicine needs to change, become less reactive, more proactive. That's an education process for medical professionals. So there are things that need to happen systemically within healthcare to change the incentives. It'd be great if insurers would get on board with the fact that they're going to make more money if they keep people healthy rather than keeping people sick. So those kinds of things are what I'm alluding to.
Yeah, so I mean, I wish I could be as optimistic as that. But if we look at the problem, I mean, let's go through the problems you just talked about. The medical profession, I can't count the number of times that medics get up on stage and they say, the first thing I was taught in medical school was first do no harm. That is essentially a demolition of the motivation for preventative medicine in general, because, and then when we look at the public, they think the same way, they'll buy the idea that prevention is better than cure at the level of, lifestyle and diet. But when it comes to preventative medicine, they get all scared because they don't distinguish between the infinitesimal chance that a medicine will make them sick when they're not yet sick versus the very good chance that it will delay how soon they get sick. And then, the insurers, I mean, absolutely. And I'm quite sure that all of the insurance companies are totally on board with the idea that they would love to be able to adjust their premiums according to health measures that they believe in, but it's illegal. It's against the law. They can't do it. They're not allowed to.
Yeah, but they could insure preventative care and pay for it and reimburse for it, right? Instead of
irrespective of measuring the outcome of the preventative care.
Yeah, you can't decline people insurance based on
or even define their premiums.
Right. Yeah, but it depends on the country. So again, it's different in different countries, but I think there are solvable. So I'm not saying it's going to be easy, and I'm not saying all of this is going to happen, but I think we are seeing some movement towards this in at least incremental ways, right? There's certainly a larger recognition of proactive approaches to health in the United States for sure. It's talked about a lot more, right? I think, changing the culture of medicine is a much more challenging proposition, but there are a growing number of medical professionals who are moving in this direction. Yeah. It creates a little bit of, that creates its own challenges, as I think we've all learned at this meeting, in the sense that lots of people are doing different things. Different people have different standards on risk reward. Some people are over in the Wild West doing stuff that isn't very evidence-based. But there is, in general, I think, a shift in mindset. Still a minority of medical professionals, but it's growing. So we're seeing movement. And again, I think I really believe that the AI tools can play a big role here, because those, like companies like Apple and Google, they're all thinking about this stuff, right? They're being very careful because they don't want to cross that line to practicing medicine. I guarantee you, if they, and they're doing this already, put resources towards creating an AI agent that was trained on real evidence-based health span medicine, we could have that next year that works really well, that would integrate your data, whatever you've got available. Maybe it's just trackable stuff. That's not going to be very good, but you could still get information from it. Maybe it'll be wearables plus comprehensive blood work, plus DEXA, plus MRI, plus all the other stuff you want to do. And you can get and an understanding of your lifestyle as it exists today. You get a really good personalized health plan that'll be mostly right, even without a doctor in the picture. And you put a qualified doctor in the picture, they'll be able to catch the mistakes. You're going to be golden. Now, will people adopt it? That's a different question. The last thing I'll say, I know I've gone on for a little bit. One of the things that also has me a little bit more optimistic is we are seeing in some parts of the world, maybe relaxation isn't quite the right word, but a relaxation of regulations that made it difficult to do preventative prescription of off-label medications. Even some countries are starting to do this is my understanding at least, bulk purchasing of medications like SGLT2 inhibitors. And it's now in the guidelines for some physicians to use things like SGLT2 inhibitors in people who are not yet diagnosed as diabetic in a preventative way. They have to be pre-diabetic, but it's a movement, right? So I think there are reasons to believe this will happen more.
Thanks for watching this Beyond Tomorrow clip. If you haven't subscribed yet to our main channel, join us there for conversations that can help you thrive today and flourish tomorrow. We'll see you next time.